So we're excited that next we get to hear from patients and their families directly. And so I want to introduce the moderator of that panel, who is Dr. Kristen Park. She is a pediatric epileptologist at Colorado Children's Hospital and the director of the GRI Center of Excellence there. Dr. Park and our families, over to you.
All right, wonderful. Thank you. So I'm excited to get to moderate this session. We have four people joining us. I don't know if they can get put on some way or not, but I'm not very tech savvy, so I don't know that I can do that. But we have Amanda Billings, who is a GRIC2 mother, Stephen Horita, who is a GRIN2A dad, Katie Gritzmacher, who is a GRIA2 mom, and then Ben Gritzmacher, who is living with GRIA2. And so, as part of this session, we kind of have a little bit of structure. As mentioned, I'm Dr. Kristen Park. I'm an epileptologist, and I'll just be kind of going through this structure that was given to me by Keith and the team. And first, in that, plan is to have each of the families just tell us a little bit about themselves, about their child, their journey so far, what they want people to know, and what has been important and formative for them during this time. So we'll start with Amanda, if she wants to go first.
Hello. Can you see me?
Yes, we can. We can see and
Okay.
hear you.
How are you doing today?
Good. How are you?
I'm doing good. I have
Good.
a sweet little girl. Her name's Haley. She's 9 years old. She has GRIC too. She was diagnosed when she was 2.5 years old. Um, so yeah, she's nonverbal. She started kind of learning how to walk at 5, but it's very wobbly, toddler like. Um, we Sorry, I'm new to this, so I'm not really sure.
All right. You just tell us whatever comes to mind.
Um, so when she was 6 months old is when they started noticing that she wasn't tracking with her eyes and things like she was supposed to. So they put us in therapy. And she ended up having to get a helmet. And then that's when they noticed that she had a lot going on. So they put us with a neurologist who did an MRI and found out she had too much white matter on her brain. So then they sent us to a genetics place and they did one test and couldn't find anything. So they did a whole exome sequencing. And that's when they found out that she had GRIC2, but they said it was so unknown, nor me or her father carried a gene for it. And they found out it was de novo, that it had somehow just developed during my pregnancy. And so it's still so unknown that the neurologist said he didn't know a lot about it. So we've just we go day by day. So it's been a struggle. A lot of therapies, a lot of school. Um, and then sorry.
It's okay.
Um, things were okay, just learning a lot of things. And then in 2022, she started throwing up all the time. Couldn't keep food down. So we dealt with a gastroenterologist for back and forth, and he diagnosed her with rumination, which I kind of knew it wasn't. But I tried to trust the process, tried to trust the doctors, which I've learned now. Sometimes you have to step up and fight for the kiddos. And so about 6 months into it, she had lost 15 pounds. She was pale. She wasn't moving anymore, playing anymore. So we were able to talk to her doctor, her pediatrician, who got us a referral to MUSC in Charleston with I'm trying to think of the word, a mobility specialist. And so we were admitted that same day into Charleston. They still don't know why she was unable to start tolerating food, but we did have to get a G tube, which a month into it, she had gained 15 pounds back, completely different child, um, strong, healthy. But that's another, I guess, frustrating thing about the disease is that we don't know why kind of the things happen the way it did. But like I said, she's getting healthy. I learned to be happy with the milestones. It's tough some days because, she's not like other kids her age. But I've learned to be thankful for what we do have, and the moments that we do have are so special. The fact that she's learning, she still doesn't talk, but she makes noises and she laughs now and smiles, and she's grown into her own little kiddo. So I have an incredible 19-year-old daughter who helps with her, and, a great support system. So it's just been a learning experience for sure.
Yeah, thanks. Thanks for sharing.
Yes, ma'am.
It's a lot to unpack, but I think kind of highlighting some of the things that many families struggle with, having things that are unknown, especially even when you get a diagnosis, having it unknown, and then having it affect, all of the body systems and having to deal with
Yeah.
so many doctors and so many, kind of different fields of medicine to navigate.
Yeah.
So yeah, I'm sure we'll come back to talk more, but let's hear from our next family. So we have Stephen, a Grin 2A dad, who can introduce his family.
Hello, I'm Steven. My daughter is Evie. I originally got asked to come and speak, and I sort of felt like, like we maybe like don't deserve it as much as some other families to be the like face of this or whatever. And then I started thinking about it and like that like maybe part of it was sort of the like overarching story of like where we've come from along the way. So like she seemed relatively normal at the start of it. Um, she actually had her first seizure at like 4 months old, but even that was like, was that a seizure? It was like maybe a seizure, right? And then as they continued, we like her older brother also has seizures, but without the genetic variant. So we knew sooner than we would have otherwise. And we knew that the type of seizures she was having, short, relatively spaced apart, we probably weren't going to be able to like cause it in front of a doctor or whatever, meant we had to get a video. We had to compile the evidence to sort of prove that what we saw was happening was actually happening. Um, and even then it was like, well, maybe there's something going on there. Um, and that's now like more than 3 years ago. She's almost 4. We got the Grin 2A diagnosis right around her first birthday. Um, and now, like, since then, we've come upon a bunch more of those sort of maybe questions, right? So we hit the um she has some speaking. She makes sentences more and more, and we're making progress, but there was a point where it was like maybe we never get sentences. Maybe we need to be practicing with sign language. But which side do we end up on? We don't know. And so you talk to someone like your doctor or whatever, and they go, maybe. It's like, okay, well, I guess we just get to decide then. Um, and then we had similar issues with feeding. We maybe would end up with a G tube. We actually almost ended up with one at one point, and then they went, I think we can put it off a little bit longer and see what happens one way or the other. And in that time where we put it off for a little while longer, we ended up sort of figuring out how to get food and stuff like that into her. And um, by the time we went back to like make the decision, um, we ended up not needing to, but the maybe question was sitting there, and there was the chance where we were going to have to be the ones that made that decision. And we were sort of like, well, can someone just tell us what the right answer is? And same with the seizures. They're generally small. We're not seeing like full tonic-clonic seizures. We're not seeing them super often. She's on two different seizure medications, but they are relatively well controlled with those two seizure medications, which uh, means that we don't qualify for drug trials that require visible motor seizures. Um, but they're still there. They still affect things. We just, you know, we're just sort of like skating by on that one. And then similar, we got an autism diagnosis, at least partially because it was one of the better ways to qualify for support in in our area. Um, and even that, while we were doing the assessments and stuff like that, it was like well, maybe this meets the. And we're like, well, can you decide maybe yes? And then low tone, poor coordination. You know, she did start to walk just after her second birthday. Um, she's 4. She would like to walk up and down stairs at this point, which, not by yourself. Uh, and uh, you know, she's not going to be the case with the highest need, and she we applied for and we got like an accessible parking pass so we can park in like the handicap parking and stuff, so she doesn't have to walk as far when we go to like a store or whatever. But we're also one of those cases where like we'll park in there and kind of feel bad about it because, we get out and we get her out of the car and she can walk and she looks like she's walking okay as long as there's no uneven ground or slopes. Um, but the like visible effect, it is not always obvious right away at the start, and you sort of go, okay, but are people watching? Because I don't really want to talk about this. Um, but I mean, she's happy. She goes to daycare. Um, we found some people that were willing to like listen to us. We found some professionals who are willing to learn about the genetic diagnosis that we have, and we move forward.
Right. Well, thanks so much. I'm hearing some of the same themes. Of course, this a lot of uncertainty, and then the burden of making these decisions. You know, I think we, as medical professionals, have this concept of shared decision making, where we have this discussion, which is different from the paternalistic, we used to tell you what to do, but also places a burden on families to have to make that decision. So I hear that. Also, this concept of kind of minimizing your own struggles when looking at other kids who are affected. And I think it's important to recognize that everyone's journey is their own, and we need all the families to participate to help us to understand how to best serve everyone with affected. So thanks for sharing. We'll move on to Katie and Ben, who I think are joining together and can tell us a little bit about their family.
Good morning. Can you say good morning?
Good morning.
Good morning.
He's not feeling well, so he will try and stick out the whole session. I'm just trying to find my slide.
But at least he gets to do it in his pajamas and his yellow smiley face pajamas.
Absolutely. They see your jammies.
Yeah.
All right. Well, I'm Katie. This is Ben. Ben's first diagnosis came at 2 months old with nystagmus. As a result of that diagnosis, he needed an MRI. Now, if you've ever had a 2-month-old go in for an MRI, let me just tell you, it's not exactly a smooth, well-oiled process. Because of a very busy children's hospital, he was taken back much later than planned, which meant he hadn't eaten for a long time. And if you know babies, you know that's not a bold strategy. He finally went in, had the MRI, and didn't wake up till the next day. They sent us home like that, which, as a parent, is a very surreal experience, walking out of a hospital carrying a baby who is still completely out of it, thinking, okay, I'm just going to trust that this is normal. Because if there's one thing I've learned about Ben's journey, is that normal was never really a part of the plan. At the time, we thought we were dealing with an eye issue. The MRI even showed a rare form of nystagmus where his optic nerve was intact. So naturally, I did what any parent would do. I went straight to the toy store and bought everything I could find that might visually stimulate him. Lights, colors, movement. It looked like we belonged in a baby rave. Because when you don't have answers, you do what you can do. But pretty quickly, it became clear this wasn't just about his eyes. 2 months later, during a birth of 3 evaluation for my then 2-year-old, I set Ben down and walked away for a minute. When I came back, the evaluator said he didn't move. As you can see on the slide, he didn't go anywhere. But that moment was the beginning of something much bigger. I didn't expect him to move. It was the start of what I now call the hurry up and wait phase of our lives. Ben didn't take the direct route to diagnosis. He took the very long, scenic route. From there, the years filled up fast. More diagnoses, therapies, specialists, surgeries, evaluations to understand the evaluations. But we kept hearing the same thing. It all adds up to something. We just don't know what. Which is a very polite way of saying we don't have a clue. At 7, he broke his arm. We didn't know until we realized he was not using his hand hours later. At 8, he had a tooth abscess that almost landed him in the hospital, and we still didn't know. But if I tried to cut his toenails, that was the most painful experience of his life. So there was a system there. We just didn't have access to it. At any time something traumatic happened, he would pass out, or something he perceived to be traumatic. It was almost a game, to warn the nurse or to not warn the nurse. As he got bigger, so did the questions. All the while, we kept searching for answers. Wait lists, specialists, more testing. We heard things like, he's too social to be autistic. He forgot to read the book. Which, if there was a book, we would have gladly read it. By the time Ben reached high school, I knew something had changed. We were running out of time to get answers that could actually help shape his future. So we made the decision to do the full genome sequencing. At that point, it felt like our last real shot. We did the blood draw shortly after his 15th birthday, and then we waited again. Because apparently that's just part of the process. But while we were waiting for answers, we started losing something else. Ben began to change. The kid who had once been called too social to be autistic stopped wanting to be around people. No more big groups, no more friends over. He would even hide in his room during his own birthday party. It felt like a piece of him quietly disappeared, right alongside his childhood. I kept wondering, was this just puberty? Or were we watching this social happy-go-lucky version of him disappear? Then the results showed up before our appointments on my chart. So I read them over and over and over. I Googled everything, translated medical language into something that made sense, tried to piece it together on my own while we waited for someone to explain it to us. Because sometimes the hardest part isn't getting the answers, it's sitting with them before you understand them. And then finally we had the appointment. I remember standing in the elevator afterward, looking at my husband, looking at Ben, and just exhaling, feeling like all the searching, never giving up, was justified. Because after 15 years of questions, we finally had an answer. GRIA2. But the search wasn't over, and it's still not. Looking back, a lot of things now make sense. The way he experienced pain, the way his body reacted to illness, the way he learned, the way he moved through the world, all those puzzle pieces we've been holding on to for years finally started to fit. Yet he was still the same kid he had always been, funny, awkward, completely himself, still asking, is Dad tricking me? The diagnosis didn't change him. It changed how we understood him. And in a way, that was the beginning of a new chapter, because the goal was never just a diagnosis. It was to understand our child. We still don't have all the answers. There's no book for GRIA2. At one point, I told a medical student to take notes. There's no book on this one. But what we do now have is something we didn't before. Clarity, direction, and a reason behind a journey that for a long time did not make sense. Ben's story didn't take a straight path. It took the long way, the confusing way, the nothing adds up until it suddenly does way. But we got there. And if there's one thing I've learned through all of this, it's sometimes the diagnosis isn't the end of the story. It's the moment the story finally starts to make sense. And we're not done. Just last year, we hit a pivotal moment at a GI appointment. The doctor looked at me and said, I just don't know. So that day, we did what we've learned to do best. We got on another wait list. This June, we will be taking Ben to Colorado to be seen at the Greek clinic. He's now 17. He still wears pull-ups. His GI system doesn't work the way it's supposed to. Or it does work the way it's supposed to, but somewhere along the way to the brain, there's a broken bridge. The message just falls off the cliff and never gets to where it needs to go, as do most of the messages his body sends to his brain. It's a guess to know when he is hurt, when he is sick, when something is making him uncomfortable. Just yesterday, I asked him if he had a headache, and he said, I'm not sure. So we're not done. There's still questions, still wait lists, still moments where we don't know what comes next. But now we're not searching in the dark anymore. We have a name, we have a direction, we have a deeper understanding of who Ben has been all along. When it came time to explain all of this to Ben, we knew one thing. We never wanted this to feel like something that was happening to him. We wanted it to be a positive something that was a part of him, something meaningful. And that's when superpowers came into our story. It's rare, and it has a name. We told Ben GRIA2 is his superpower, and that it helps explain the things that make him uniquely him. From that moment on, that's how we've chose to see it. In our house and in our community, we celebrate superpowers. We celebrate GRIA2 Day. We celebrate his friends' superpower days. He takes treats into school for all of his helpers. Because every one of these kids carries something unique, something the world is still learning to understand. And maybe that's the most important part of the journey, not just finding a diagnosis, but choosing how we tell the story that goes along with it. Because this story was never just about GRIA2. It's about Ben, and his story is still being written. Our next chapter will be how we can support Ben as an adult and what GRIA looks like for adults. Thank you.
Thank you so much. That was very well spoken, story of your life with Ben. And Ben, do you have anything to add that you wanted to say to what your mom said?
No.
You can say it loud.
No.
Okay, sounds good.
Ben is a quiet, soft-spoken kind of guy. Man of
Sounds like
little
it.
words.
Okay. Well, again, hearing a lot of similar themes about, the unknown and waiting and, medical professionals not knowing, what the answers are. So, thanks for, sharing those and helping other families to realize that they're not alone in their struggles. So, the next thing I think that we had was, some questions that I wanted to try and go through. So the first one that I'll ask everyone is, kind of what is a win for you at the moment? What things, mark a great day? It could be, something like, a goal that you have, or a milestone, or a moment that, has kind of brought you joy or brought you together as a family. If you want to, we'll start with you, Katie, since your microphone is still on and your picture is still on the screen. So what would that be for you?
Like I said, we acknowledge this as a superpower, and he refers, if we're going someplace that's geared towards special needs kids, we refer to them as superpower kids. And we just celebrate this life in a positive way. In our house, Ben is not different. He has 3 older brothers and a younger sister, and this is just our life.
Okay. All right. So a win is meeting other kids, maybe with superpowers.
Yes.
All right. Awesome. Stephen, anything that you want to, tell us about, a moment that has been a win or a milestone for your family?
Yeah, when we were thinking about this, I was sort of thinking we often feel like we miss the wins. Like we're always looking for the sort of big wins and stuff, and then we don't notice some of the small ones. Um, but then when we look back like a year or something, then sometimes we notice like in one area or another how far we might have come. So like a year ago, she didn't really chew food at all. Everything had to be swallow right now, or it needed to be liquid or whatever. And now when we look at like current, if something is like hard and crunchy, she's willing to like crunch it and um we've like expanded the foods that we can eat by quite a bit and stuff like that. But it happened a little bit at a time and a little bit at a time. And so like that day by day we maybe don't notice, but then when we look back further, we see the distance we've actually come.
Yeah. Hard to keep that perspective that you're making progress when it's incremental every day. But maybe just taking some time every once in a while to think about, where you were X amount of time ago and what progress you've made can help, bring those moments home for people. Because I think that's a lot of incremental movement for many issues. So thanks. Um, Amanda, how about you? Anything that you want to share that's been
Um,
uh,
she she's become more affectionate. For a long time, she didn't hug, she didn't smile, she didn't laugh, she didn't acknowledge you. And it's become more of we cackle all the time. She loves Veggie Tales. That's her main and only TV show that she enjoys watching. So she laughs and cackles at that. And then when she is allowed to eat comfort foods, and she's becoming more um kind of what off Ben said. I'm sorry, not Ben, but what he said was it used to just be, I'm going to get it in my mouth and swallow it as fast as I can. And she's actually chewing and taking her time to enjoy it. So that's been another big win for us.
good? Yeah, it's important to have those positive things that bring, connection to life, right? Affection and interaction with your family to be able to enjoy that, and then to be able to enjoy food, which isn't just energy; it's also, a joy in life. So those are some great wins. Um, so I think another one, if we talk about wins, oh, Ben left. I was going to ask him a question. That's okay. Uh,
You can. He's right here. He's
oh, he just
just
moved around the corner.
right.
Okay.
Yeah, he's just
So
out of.
so we had talked about, these wins or, things that have gone well. And so I'm wondering if you might have a goal that you're, working towards or something that you're excited to do in the future, especially since you're becoming a young man.
Do you remember? Can you come over here? Did you what is the goal that you work on? What is one of our rules that we do when we go places?
I want new thing.
Can you come closer and say it real loud?
I want new thing.
But find one new friend.
No, it was try one new thing. So
Oh,
when
sorry.
we go
Okay, sorry.
out
Try
into the
one new
community,
thing.
yeah, one of his goals is he has to try something new every time we go out and do something. Because around puberty, he did kind of have some social regression. We also, when there's no school, he has to get out of the house at least twice a week.
Okay. I
Those are
love
some.
those goals.
And
How
then
are you doing with them? Do you feel like they are good goals that help you to do things?
Yeah.
Yeah, great. I love it. I love it. I think everybody should have that goal to try one new thing, right? Expands your world and makes your life more interesting to do new things. Cool.
it
Cool.
started with slides because with his depth perception and his vision issues, he wasn't able to see the bottom of the slide. So I would literally have to pick him up and shove him down a slide to show him that it was fun.
Yeah.
And so
Yeah.
now that's how our goals transpired. And then what's something you're looking forward to?
Mm,
Are you looking forward to graduating high school?
yeah.
Tell them. Sit up, tell them.
Graduate high school.
When is that?
Are you graduating this year or next year?
Next year.
Next year. All right. Well, that is certainly something to look forward to. That's a big day. All right. So another question, I think, we're spending this time to learn about science and, new treatments, new developments. What are you all kind of looking forward to, and what are your hopes for the next several years? We can start again with you, Katie, since you're on screen.
Okay. Well, we're definitely looking forward to coming to the Greek clinic. We still have a lot of questions that we're hoping to get answers for. And I think because it's so unknown, I think we'll always be searching for answers to questions and helping the doctors here locally understand Ben. It's not that Ben needs to change or be different at this point, we're not even necessarily looking for him to be cured. We're looking for an understanding. We need to understand, we need to meet him where he is. And I think our biggest goal is just what his future holds for him, how he can be a successful adult.
Okay.
And whatever success looks like for him.
Right, right. Those are some big hopes for the next several years. So I think, yeah, we all want to learn more and understand more, and I think that's why we're coming together is to help with that. So, Stephen, how about you? What are you looking forward to learning about, or for the hopes for the science or the future?
Well, I mean, being GRIN2A classified as likely gain of function variant, we are interested to see what happens with the radiprotil trial. Like I was saying earlier, we won't qualify for the actual trial itself because of the countable motor seizure requirements on that, but we're curious to see where that goes. And if you ask her, she'll tell you she's excited to go to kindergarten next year. Well, she would like to go tomorrow, but she doesn't she doesn't go until next year.
Great. All right. How about you, Amanda? Things that you're excited to about for the future with regards to what you're learning and the science and the developments.
Just more her growing into who she can be and finding what she can do in the future. Um, just science of, I know she may never be cured, but maybe helping find things that can help her live I guess, a more fuller life. But my brother, he's kind of been a big thing for me, and I was struggling a lot with it. And he told me one day, he said, Haley's life isn't hard. He's like, Haley is happy in the life she's in. He's like, that's her normal life. He's like, it's tough for you and it's tough for other people. He's like, but you need to realize that Haley's life is perfect for Haley. So that's what I try to do. But, I would love to understand more and know more of what's going on. But just seeing where it goes and her living her fullest potential.
Yeah. I think those are important points that you and Katie made, that it's not the person that needs to change, it's the world, and it's us that needs to understand things better, and that her life is her life, and we need to figure out how to help her live it the best that she can, and how to make it not painful, or not having problems that we can help to solve. So
And I don't know if they struggle with it. Something that's been kind of, I guess, difficult for me is her pain tolerance is ridiculously high. Like, she doesn't cry at IV, she doesn't cry at shots. When she falls, she doesn't cry. Never knowing if she's in pain and stuff. So hopefully one day we can,
yeah,
be able to know that, because that's tough sometimes, not knowing if she's
sure,
hurting or
sure.
things like that.
Yeah, it sounded like that was a big part of Katie and Ben's
Yeah.
If it's
experience.
okay, I'd like to respond to that.
Yeah.
We've determined that part of his superpower is that he doesn't feel pain.
Yeah.
He actually had a GI appointment where they went in through his rectum while he was awake with a camera.
Wow.
And they decided, as far as his GI is concerned, everything is working properly. But during that, with a hose going up his rear end and a balloon being inflated, he fell asleep.
Oh, wow.
Which never happens. So we have determined that he does not feel pain. He does not understand. It's that piece that's missing, the message that goes up to the brain. It falls
Right.
off a cliff, isn't making it. And so it is a constant guess, and it is a constant having to understand what is going on in the situation.
Yeah.
And we've had to put his teachers on alert for that as well. And then his way of dealing with that is after the traumatic thing that happens, whether it be a shot or a temper tantrum or whatever, he passes out. And now we're
Oh, wow.
looking at it as possibly a dysautonomia episode.
Okay.
But that has been something that we didn't learn until he was 15 with diagnosis. That has been happening to him since he was little. He would pass out anytime he would get injured or perceive something to be traumatic.
Oh, wow.
That signal gets processed in a different way.
Yes.
Yeah. Okay.
Thank you for that.
Yeah.
Kristen, I have a question in the Q&A if
Great.
we want to answer. Okay. So this is for any of the panelists. Curious to hear what kind of support is the most helpful for you guys?
I think at this point for us, it's just understanding and having people to talk to and meeting us where we're at.
For me, it's been, my family and my support system, but also now meeting other parents whose children have the GRID disorders. That's been a big deal because they kind of know where you are and how you're feeling and the struggles that you live with daily. So that's been a huge help for me.
I think for us, one of the biggest things was actually for us to find the like local like parents of kids with autism group, just because th they knew how to like deal with the support that we needed for preschool, and they knew how to like how to get the things that we needed from our like local area and stuff. So like finding a group of people who, even if it's not exactly the same as what we have, knew the things that were nearby that we needed and stuff. She came to say hi, but she also let me know it's just talking. I go now.
Yes. Very boring. Very boring adult topics. Oh, that's so cute. Yeah, I think both, it sounds like, kind of both emotional and logistical support are needed to kind of help families. And I would wholeheartedly agree with that. Do we have, I thought I saw some other questions in the chat there.
Not
Oh,
necessarily a
Ben has
question.
also asked to leave. Okay. We're very boring.
Not necessarily a question, but a conversation that's going on. I'd love to hear some thoughts from that. So my son was Carter. He had Grim 1. So we dealt with this a lot, even though he was in a wheelchair. But I'd like to get other people's perspective. So getting the how do you handle when your child looks typical? So your child is not typical, but Carter, if he wasn't in his wheelchair, people 100% thought he was a typical child. So how did you guys handle that when that happens?
I used to get upset, especially at trick-or-treating, We would have people not give him candy until he said trick or treats. And I used to get frustrated with that. We've had just recently, we went to a transition fair for transitioning to adulthood. And by looking at Ben, they assumed they knew everything they needed to know just by looking at him. And I, you know, had to, I let it go at the time, but it's just more of an understanding that it's more of a personal understanding than a trying to make the whole world understand. You have to kind of pick and choose what you want to share. So, Ben is not independent because he does not bathroom independently and, things along those lines. And not everyone in the world needs to know that. So we just make sure that we're open with the people we need to be open with, and the people who are going to be in his life on a daily basis understand that he needs help getting food, he needs help bathrooming, he needs certain helps. And then other people, you just kind of have to put a smile on your face and understand that he doesn't know that he's different or that people are looking at him differently, and he's happy, and we need to take our cues from them.
Yeah, I think for us, it depends on where we are, right? If we're going to the store or whatever, it was learning that like what other people think doesn't really matter. Um, and then when it came to like family friends or whatever, like some of them were gonna like figure it out, and uh, maybe some of them didn't need to come visit anymore. Realistically. And then when it came to like doctors and stuff like that, it meant like we had to get our sometimes we have to get our paperwork in order ahead of time and stuff. And sometimes it meant that like you go to a doctor's visit and when they ask a question, don't give the hopeful answer or whatever it is. Like don't say, "Oh, well, we can almost do that," or anything like that. Say, "No, we can't do that. No, we can't. No, we can't." You give the most like negative pessimistic version, you know how, because optimism doesn't actually get you support.
Amanda, did you have anything to add to that?
Yeah, for Haley, it was a lot of times when we're out somewhere and people will like talk to her. And of course, she's nonverbal. So it was almost like I was getting rude comments like, your child should acknowledge when somebody talks to them, or things like that was really difficult for me. And for a while, I would kind of pop off and be like, well, she can't talk if it's any of your business. But uh, after that, I just kind of had to take it with a grain of salt and realize that maybe they don't understand. And then we had went to an orthopedic appointment. She was probably about 5, and I was carrying her. And a woman was like, if you would put her down, she could walk. You shouldn't make her, you shouldn't. And I was like, well, she can't, you know, walk by herself. Well, she looks fine. Okay. I'm glad she looks fine. But so I've just learned that I don't have to answer all the questions, kind of, and make them feel better about my situation. It's kind of how it's been for me.
Yeah, those are some heavy topics, and a lot of, I'm sure, thoughts and adaptations over the years to figure out how to deal with a world that doesn't necessarily understand how to deal with kids with these superpowers, as we're saying, or kids who need different things. So it sounds like somebody was suggesting just kind of surrounding yourself with, people that already know those things, that get them, or helping people to, important people in your life to get to the point where they understand things a little bit better. Did we have other questions, Lauren, I'm not sure what our time frame is. I think we have maybe 10 more minutes.
No
So,
other questions. We do have one more minute until we go to break.
oh, one more minute. Oh, well, that's a
It
perfect.
was perfect.
We did great. We did great. I only missed one prepared question, and so we had a lot of really good comments. I think really resonated with a lot of people. I was seeing a lot of me too, and yes, this is a good way to think about it, and a lot of kind of again resonation with everyone who is listening. So I think that's really one of the things that I think is so important about sessions like this is hearing, what everyone has done, so that can help you guys, make think about things and process everything. So thanks so much for letting me be a part of that and hearing all of your stories and your experiences. It's been pretty powerful. So I think we have a break and then our first session. Yeah.
Yeah, I'm gonna let Keith come on. We'll talk about platform access really quick because I didn't get to cover that in the beginning, so people know exactly how to join once they get out of the main session. And then we'll go to break. Awesome. Thanks so much, Kristen, and thanks, Stephen and Katie and Ben and Amanda.
Yeah.
We're so appreciative. This is one of my favorite panels that we do every year for our conferences, and I always look forward to hearing everybody's stories. So
Yeah.
thank you guys
Yeah.
so much for everything.
Agreed.
Uh,
Agreed.
It took me a minute
thanks so
to
much, Kristen.
Yeah.
it took me a minute to join, but I have down in the schedule that this is going for another 10 minutes. So do we
That's
want
what
to
I had
start
too.
everything?
So
Do we
I'm
want to
looking
keep
in the
going for 10
chat.
minutes?
Yeah, let's see if you guys are good. Let me see some chat. I don't have any questions, but maybe a conversation.
well, I have one more that I didn't ask,
Oh, that's
so I
perfect.
can
Okay,
I
Kristen,
can
yeah,
bring
go
it out
ahead.
now.
Go ahead, sure.
So this one was, for everybody kind of looking back. For some people, it's longer looking back than others. But what was something at the beginning that you wish that you knew that you know now that could have made a big impact for you? And we won't start with Katie since she had to go first all the time. So maybe we'll start with Amanda.
I guess just maybe knowing the better questions to ask, or not being, I guess, so scared to stand, not scared, but nervous to stand up for her and maybe demand more answers. I felt like with a lot of doctors that didn't understand it, they would kind of just brush it under the rug and kind of make me feel like I was maybe pushing for something, or that maybe, if that makes sense.
No,
I just wish I would have known, or I guess worked harder at being an advocate for her. And I think maybe we could have got answers sooner than we did in a lot of situations.
yeah. That's a hard skill, and
Yes.
one that doesn't come easily, especially if you have to be, confrontational in a relationship that, is not even. And so I think I thought I saw that there was a session about becoming an advocate, and I think that, many families might, if that's an important thing you wish you had done, and maybe many families could, kind of sign up for that session and get those skills and learn about them early on. So
And
thanks.
I think maybe a lot of times you focus on watching for the bad stuff and missing the good stuff. So
Mhm.
that's something that I try to focus on more, is the wins and not the other stuff.
Great. Thanks. That's wonderful. Stephen, how about you? Anything that you wish you had known when you started that you know now?
Yeah, so thinking about this question, we had sort of two answers. One of them was the one that I sort of referred to earlier, where I was saying like we sort of had to learn to almost like almost like talk down our kid when we're like asking for things, and like we would love to like focus on the positives all the time, but like when you go in and you say, "Hey, we really want to like look at if there's something we can do about this thing that's happening, we that's not the time to focus on the positive, and we needed to learn to be like, everything is terrible, and then walk out of an appointment and go, wow, that was sort of mean, but she doesn't know that we were mean to her, so hey, I guess it's okay. And then the other thing that we found was we weren't originally, we thought we were like going to like find doctors and specialists and stuff like that who had answers, and now we've sort of learned that we're actually going, we want to find the doctors who start the like meeting with, okay, well, what new things have come up about like GRIN2A disorders in the last 6 months or whatever, and ask us, because we have the like narrow focus on the single thing, where like there's no specialist we're gonna get assigned to who spends, you know, even 5% of their time looking at like her specific disorder, because like no children's hospital neurologist gets to focus on a single disorder for any significant amount of time. So
Yeah.
finding the ones that want to ask us and want to learn um, together, it is more important than finding ones who have answers.
Yeah, I think it's sad that our oops. Oh, okay. I thought I heard someone saying it's sad that our medical system is not built to, lift people up and support them. It's built to, answer questions or to take care of things when they arise. It's not built to, kind of promote wellness and health and give things. It's designed to restrict, and learning to navigate that is a challenge. So. Yeah. So, Katie, I think I saw that you were saying also, that you had to kind of make some of those same statements. Anything else that you wanted to add about this question about what you wish you had known?
Yeah. I wish we would have understood the pain piece a lot earlier on. We tried telling doctors for a long time that we thought that was a part of him, and he doesn't fit the neurologist's definition of not feeling pain. Um, but it goes along with the nervous system and his GI stuff. And, we spent a lot of exhausting, tearful hours trying to potty train him and got frustrated and all the things. Just to, this is who he is, and this is part of what the disorder is doing to him. And now, it's just something we accept, that he's in pull-ups, and we have to guess when he doesn't feel well and those kinds of things. Like yesterday, I was unsure, but I kept him home from school and he slept the entire day. So he clearly wasn't feeling well. So understanding that was part of who he was a long time ago probably would have helped some sleepless days.
Okay. Yeah, that's tough. Yeah, I think the retrospectoscope is a powerful tool, but it's also one that nobody has access to at any given moment because of its nature. So at least maybe we can provide some insights to some other families about what we've seen there. So did anything come up in the chat, Lauren, that we have to that we can maybe look at in the last couple minutes?
No more questions, but a lot of talk about the pain connection.
Yeah.
Apparently that is really what's a good word? Everybody I talk to seems to experience one way or the other, either a very high pain tolerance or an extremely, extremely low pain tolerance.
Yeah, it's strange how it can have such those opposite extremes.
Complete opposite. And I think one thing that people it's hard kind of to see, because if your child has GRIN1, you're usually more associated with families that have GRIN1, but it's across the board.
Mhm.
And Carter with GRIN1 was actually more similar to one little boy who had GRIN2B than any of the other kids I ever met. So I think that's another thing too, that our kids do share that across each of the GRI disorders.
Yeah. And those similarities and differences are complex to understand, but they certainly exist. So, all right, well, wonderful. I'm glad we got that last question and those last perspectives from our families, who once again were wonderful in sharing their experiences. So,
Yeah, thank you so much again, Dr. Park, and to
yeah.
all of the families. Really appreciate it. One thing just to note, because there was a mention of a patient maybe not qualifying for the GRIN Therapeutics trial because
Oh,
there aren't
definitely.
countable seizures. It's worth noting that there are 2 cohorts in that study, and one of them, even if your kid has seizures but not enough countable seizures, they would qualify for that other cohort, I believe. And so GRIN
Yep.
Therapeutics is, yeah, that Kristen's saying that's right. So yeah, so
It's
still,
it's a behavioral cohort,
yeah.
meaning that it looks at some of the other symptoms of GRIN or developmental disorder. There is a cap on enrollment in that group. So I wouldn't say 100% everybody, can do it, but yes, it's not an automatic exclusion if you don't have sufficient seizures. So I would recommend, kind of talking to your doctor, or to at least to go to the site and to figure out where there might be an eligible center near you, and talk to somebody about whether your child would qualify.
Now,
Okay.
is there one for GRIC 2 yet? Like any clinical trials or?
No, this is for GRIN with an N.
Right.
No, not yet for the other receptor types.
I tried to research it, but I knew I hadn't seen anything yet. So I
Yeah.
was just curious.
Yeah, so in the panel that we have later today, where we're talking about clinical trials, there's 2 clinical trials that are open to a broader group of patients, but those are just with epilepsy. And
Right.
then in our gene therapy trial today, we're hearing from Dr. Jeff Swanson, who's starting some preclinical work, so meaning on animals with a gene therapy for GRIC2.